All right, everybody, we're back. Brand new show today. Can't wait to get into a topic that everybody has an opinion on, and that's whether BMI actually matters for overall health and fitness. And so I think you actually have to look at it in two different ways. Is that you have to look at it as general population, and then we also want to look at it in terms of maybe like the top 1% in elite-based shape. But what I'm going to take you through here today is something that anyone can use. So I'm going to give you three other factors, three other indicators besides BMI, that if you're good on those three, I don't think that you need to worry about your BMI as much. Truthfully, it's probably not affecting you to the same degree as it would for other people. I will say that overall, the higher your BMI, most likely the greater the stress of the body is under. And that's because body mass index is, simply put, this is all that it is. It is your weight over your height squared. That's all that it is, and that gives you your BMI. But what I'm going to do is make it easier for you. You can head on over to stevencabral.com/3149. I'll actually give you all of the different charts. So you can just look at your height and you can look at your weight, whether it's in meters or whether it's in kilograms or pounds, obviously, and inches, and you'll be able to scroll over and find where you are. In an ideal world, again, just ideal world, you're between a 19 and a 24.9. And better to be closer to the middle, but it's okay. Again, I'm at the very top of that, and I wouldn't consider myself a very large individual. It's just for my body type and being in shape, I'm at that top of that BMI. So what matters then is maybe for someone like myself as well, you look at saying, okay, I want to try to stay within this BMI, but let me see if these other three indicators are on point and balanced, because if not, that BMI actually then makes a greater difference. Same with being at the very bottom of it. All right, so let's dive right into it. The first one that you want to look at, and the one that I would say, more fitness and bodybuilding community is more interested in, is body fat percentage. All right, so forget about BMI. Let's just talk about body fat. You can actually purchase a very inexpensive set of skin fold calipers that you can use right at home. So you can do a 3-point measuring system. It has an inaccuracy of about plus or minus 3%. So yes, it can be off a little bit. If you get someone that's qualified doing it though, such as a qualified personal trainer, exercise physiologist, etc., it can be pretty much on point. The bioelectrical impedance ones, the ones that you step on the scales, those have a plus or minus of up to 6%. So I'm not going to recommend hydrostatic weighing or other things like that, but honestly, you just try to get the best you can measurement. And there's other online calculators as well where you type in different measurements and it will estimate your body fat. Truthfully, I found the body fat calipers, the skin fold calipers that are like $19 to be really helpful. And I'll link those up here today, the ones that we use as well. All right, let me take you through the body fat. So you're more concerned about BMI as a man if your body fat percentage is above 25%. Okay, so high BMI and high body fat percentage, it matters, like without a doubt. Okay, let's say that you're within the average the average body fat percentage. So body fat percentage just means if you're 200 pounds and you're 30% body fat, that means 60 pounds of that 200, right, is body fat, right? That's how we look at it. Or let's say that you're 20%, you're within the average range. 20% would be 40 pounds of your 200 pounds is body fat. The rest of it is lean body mass, organ, tissue, water, etc. Okay, so let's move down the line, 18 to 24. The healthiest range that we like really for our clients to be in is between the 14 and 18% for men. It's able to be fairly easily maintained without being overly strict. You can be in great shape, all of those different things. Athletes are more in that 7, or I should say more like, 6, 7% to 13%. And we don't recommend going obviously below that 6 or 7%. You're teetering then at that point on being far too catabolic. Okay, so that's for men. And then for women, it's 32% body fat and above. Average would be 25 to 31%. We like women between the 20 and 24%. That's what we aim for in our practice. But we're okay with dropping down to right around the 18% to 24%. Don't want to go below 14%. So 14 to 20 would be more like athletic. So athletes, females. And then essential body fat for females, unlike men. So men, it's 6% really and above. For women, it's 10% to 13% is the very minimum. Although I'll let you know that in my practice, and I've seen this in many others as well, once women start to get to below 13% or right around 13%, they can start to move into amenorrhea and lose their menstrual cycle. So important to look at all those factors, but let's just say that you are a female and you're 24% or below, BMI may not matter as much. If you're a male and you are between, well, let's just say you're less than 18%, BMI may not matter as much. All right, so there's your first indicator. The second one, waist-hip ratio. We spoke a little bit about that on the last Friday review. Waist-hip ratio, really simple. You're going to take a piece of string or a retractable floppy tape measure, and you're just gonna go around the widest part of your waist, usually right around the belly button, the navel. You just measure it, whatever it is. Don't try to pull it too tight. Just keep it at a normal tension, and you're gonna write down that number. The next one you're gonna take is your hip measurement. You're gonna go around the widest part of your hips, right around your glutes, and your feet should be about 3 inches apart. That's it, just a normal stance. And then you're just gonna take the measurement by your waist divided by hip measurement. And for men, we are looking at a 0.9, and for women, a 0.85 is the measurement that we are looking for. I just want to confirm that because I may have switched that. And yes, it's for men 0.9 or less and women 0.85 or less, because anything higher shows a greater rate then for cardiovascular issues, certain types of cancers, gallstones, et cetera. And we talked about that on the last Friday review. If you'd like to learn more, I also have a previous podcast on waist-hip ratio. But really simply put, if your waist-hip ratio is definitely less than 0.9 for men and 0.85 for women, then your BMI, again, doesn't matter as much. All right, the third risk factor, or I should just say indicator of your overall health and fitness, is your resting heart rate. So a lot of people overlook this one because you could be in great shape, honestly. Let's say you're in great shape in terms of again, I'm not talking about like the shape of your body. I'm talking about your BMI. I'm talking about your body fat percentage, your waist-hip ratio, where people are like, okay, yeah, that person's fit. And here's the thing though, they have a resting heart rate of 88 or 92. And if they go to their PCP or their regular doctor, your healthy heart rate could be anywhere between 60 and 100. When from a health standpoint, that's not optimal. So a resting heart rate, meaning at rest, so you're seated at your desk, you're just looking at your heart rate monitor, somewhere between 50 and 80. Definitely not 60 to 100. So once your heart rate at rest starts to be above 80, think about the stress that has on your body. It's actually quite high. I talked a little bit about that again on a previous show. I'm just trying to pull everything together for this one show so that you can pass this test essentially. Is your BMI between 24.9? Is your body fat percentage within that male-female zone that I spoke about before? Let's say less than around 18% for men, ideally, and less than that 24% for women. Okay. Is your waist-hip ratio 0.9 or less for a male and 0.85 or less for women? And then is your resting heart rate between that 50 and 80 during the day? And overnight, if you're tracking it, well, it could even drop down into the 40s. But if you're sleeping overnight and your resting heart rate is in the 80s, it's a sign that there is a greater stress on your body, and it's absolutely worth looking into. So I know if I ever get a cold or virus or anything like that, I might have a resting heart rate overnight in the 60s. For me, that's not necessarily normal. My resting heart rate, some people's is in the 40s, mine's in the 50s. And so when I look at it, I say, yeah, my body is actually not recovering as well because I am sick. There's a little bit more inflammation, and you can see it. That stress level on my body shows up in a lower heart rate variability, but which is just more difficult to track, honestly, because there's genetic variance. But my resting heart rate is higher than it normally is than my baseline, and everybody can look at their baseline. So again, overall, a lot of people, they don't like to look at BMI. I do. I look at BMI overall, but I can cancel out BMI for the most part if it's not egregious, like a 29 plus, right? I can cancel it out for the most part if someone has a healthy waist-hip ratio, they have a healthy body fat percentage, and they have a healthy heart rate. So let me know in the comments below if this was helpful, if you pass all 4 of those, if you need to work on one. I think all of these things are different factors to look at our overall health. And truthfully, the better and larger the picture we have, the better it is for overall outcome in terms of health, dis-ease, and overall longevity. So hopefully this was helpful. I'm going to link up all of these charts, so literally every single one of them, if you want to calculate your waist-hip ratio, your BMI, body fat, etc. That will all be at StephenCabral.com/3149 for all those details. Once again, StephenCabral.com/3149. Hopefully this was helpful. Do feel free to share it with anyone you think it could serve. Take care, everybody. Thanks so much for tuning into today's show. Before you go, don't forget to hit that subscribe button. I want to make sure that you're getting our daily content, not missing out on anything functional medicine, wellness, weight gain, weight loss, anti-aging, living longer, stronger, and all of the most cutting-edge research. And if there's any topics you want to hear, feel free to leave them in the comments below. Take care.